I'm wondering what care looked like. What would we say care looked like before COVID? How does care look now? And through the lens of COVID, when we look back at care, how does it look different?
I'm Lawrence Yang. I'm a family doctor in Surrey, British Columbia.
I am Jami Brown, and I am a mom, and I am a wife. But I've also had the pleasure of working and engaging people for probably close to about 25 years.
My name is Jana Buhlmann. How do I want to introduce myself today? I'm a mom. I'm a bureaucrat by day, and where in the edges, in the gaps, I'm a patient and caregiver advocate.
I've called this in the past, I've called this podcast the FTS podcast, which stands for Fuck the Silos, because silos really, the silos represent, the different parts of our system that are supposed to co-labor and work together and bring us together, but in fact, for some reason are separate. And when we settle for the information or the people that are within just our silo, there's really no way that we can get care quality to the level where it needs to be for the community.
Social media has contributed, in my opinion, to, the ability of people to say things behind that mask.
What are some of the things that are being said about this situation?
Do you have a couple hours or a day to talk about all that? It's less asset building and less, how can we, get in the same room? How can we collectively start to have conversations? And it's more a bit somewhat mob mentality type posts. And that is not everybody.
It's fear, right? I mean, it's these are people's real life stories, and whether you want to use the word brave or honest or fearfully or in reaction, they are sharing those stories. They are using social media as a means of almost like reaching their hand through the screen to say, can you help me? I want to see my mother. I'm seeing her wither away through the very narrow pinhole of the nurse's phone.
This is a human experience we're dealing with, and so people will make mistakes. The question is, do we learn from them? How do we work together in the future?
In that heightened level of stress and fear, our ability to actually absorb and take in multiple viewpoints often reduces. We get tunnel vision when we are fight or flight. I remember reading that trauma is when one's ability to cope with stress is potentially near overwhelmed. And health professionals have those same human reactions to trauma.
Probably the hardest thing is that pain and death are unavoidable right now, and have been in the last couple of months, right? That's the hardest part. But I often will say, I see you. I see you. And I think that is part of holding space. And I think it has a trauma-informed care component to it, in that I see you. And it leaves space for people to say who you is, right? To say who I am. So it's not, I understand what you're going through, or I can totally identify with that. It's just, I see you.
If you enjoyed that trailer, don't forget to click the thumbs up and subscribe. You can find the link to the full-length episode in the description below.